How to stay safe during COVID-19. COVID-19 has killed more than 490,000 people worldwide, according to the World Health Organization. The COVID-19 pandemic is devastating and kills thousands of people every day. All of us are at risk and need to take action to prevent the spread. I have thoroughly researched this topic on sites such as the CDC and the World Health Organization. Through social distancing, using protective gear, and taking precautions, we can slow and hopefully stop the spread of this deadly disease. Social distancing should be the first and foremost way that we try to combat COVID-19. I use the CDC website to learn more about social distancing. This disease is very contagious but tends to only spread to people who have been within 6 feet of an infected person. The primary way that it spreads is through particles in the cough or sneeze of a contagious person. These particles can only travel a certain distance, so the further you are away from other people, the less likely it is that you are able to contract the virus. Many stores and businesses have tried to enforce social distancing through several means, such as placing tape at the checkout so everyone knows to stay 6 feet apart, or by having people work from home. I've been to restaurants during COVID-19, and this spacing out is apparent wherever you look. The customers tend to stay distanced from others. There are a variety of ways to social distance, and it is imperative that we do so. People all over the country are social distancing, but because of jobs, religion, etc., they still need to keep in touch with other people. Tools such as Zoom, Skype, and Microsoft Teams are being used to communicate without the threat of spreading the virus. Schools are even taking part in this by converting to online learning and resorting to video meetings and email to connect with their students. For example, the class that this speech is for is completely online. However, not everyone is able to social distance. If it is not possible to stay away from other people, it is critical that we wear protection to reduce the spread. According to the CDC, the best method of protection available for everyday use is face masks. These face masks stop the bacteria in our breath from being transmitted to other people. Contrary to popular belief, face masks are meant to protect others from you, not the other way around. People are commonly making their own masks at home because masks are in high demand and the price has gone up, or they are just unavailable. Higher-end masks, like the N95 mask, are being used by healthcare professionals that are exposed to COVID-19 every day. Hand sanitizer can also be very effective for killing this virus. It will not stop you from coming into contact with the virus, but it can eliminate the virus after the fact. I use the North Carolina Department of Health and Human Services as a resource for this information. Hand sanitizer is in great need right now, all over the country, because people are using it up to keep them safe, but manufacturers cannot always keep up. Businesses are even using hand sanitizer as a required means of protection for customers. For example, when I went to the dentist, the first thing that they had me do was use hand sanitizer that they had on their counter. Every customer had to do this to keep everyone safe. However, washing your hands thoroughly with soap is also very effective, and is available to most Americans today. It is not used enough as people believe they need some highly engineered piece of technology to keep them safe, but washing your hands goes a long way. My brother washes his hands every time he comes home from his job, just as a precaution to keep us safe. Preventive measures are essential because anyone could be the person that gives you COVID-19. We can never be sure who does and who doesn't have this disease, so we must act like we all have it to stay safe. There is no way for certain to know if someone is sick. You don't know if it's the cashier when you're checking out groceries, or the person who walked by you on your way in. So, to avoid contracting this illness, acting like everyone has it is the safest option. COVID-19 is different for everyone. The symptoms can be mild to life-threatening. According to the Huffington Post, many people are simply carriers of the disease and are able to transmit it, but do not show symptoms. Others are in the early stages of the disease, where they don't show symptoms, but are still able to spread it. People like these do not know to go for testing, but can still be contagious. One of the members of my church even had her mother and her aunt get COVID-19 because one of the workers at their nursing home came in sick, but nobody knew. Many of the staff and residents now have this disease, and several have died because of this incident. The staff member was not able to social distance because she was working with people at the nursing home, but the proper precautions were not taken, or no one would have gotten this illness. Overall, COVID-19 is a deadly disease, and we all have our parts to play in making sure no one else has to get sick from it. The most effective way that we can protect ourselves from this disease is social distancing. If that is not possible for your situation, other preventive methods, such as using face masks, hand sanitizer, and washing your hands, should be used. Even if you feel that you are safe, keep in mind that your actions have consequences, for not just you, but for those around you. So the next time you go somewhere, remember that what you do could decide someone else's fate. Finally, don't assume that people who aren't showing symptoms don't have COVID-19. As Chuck Nolan puts it, I know what I have to do now. I've got to keep breathing, because tomorrow the sun will rise. Who knows what the tide could bring? This quote was found on CNN. Thank you for your time, and be safe.